Hi, this is Nida Lakhani, and today we'll be talking about Turner syndrome. It's also known as gonadal dysgenesis, Barnaby-Ullrich syndrome, 45XO, and monosomy X. So just to give you guys an introduction into Turner syndrome, it does affect 1 out of every 2,500 female newborns. It's also a cause of 10% of all miscarriages. The clinical presentations vary, and they actually do vary amongst individuals, and there are a broad range of clinical presentations as you will see. It's caused by a mutation during sex cell division, and it's not inherited or passed down from a parent. Females with Turner syndrome either have what's called an XO pattern, in which one X chromosome is missing, or they have an incomplete second X chromosome. The condition only affects females since it involves having a missing or incomplete second X chromosome. This is a picture of a karyotype of a patient with Turner syndrome, and as you can see on the lower right-hand corner, the pink shaded X chromosome is missing, so we would say that this patient actually has a XO pattern. This is just a timeline to give you guys some history about how Turner syndrome was discovered. So in 1930, it was first described by Ullrich, and he is from Germany. 1938, Henry Turner described a group of women ages 15 to 23, and they were mainly characterized by a short stature and delayed puberty. And then finally, in 1959, a group of scientists, including Ford, discovered that the syndrome actually had a chromosomal basis. And you can kind of see where the name Turner syndrome came about from this timeline. So some risk factors. There are no genetic or environmental risk factors for Turner syndrome because of the spontaneous chromosomal mutation. But you will see that in the karyotype, all or part of one of the X chromosomes is missing. And again, it's not inherited from either parent. Some clinical presentations for Turner syndrome: when you do a prenatal ultrasound, you will notice large fluid collection on the back of the neck of the fetus. And as you can see the picture, you can compare normal with the abnormal. And you see in the abnormal, the fetus has a collection of fluid on the back of the neck. You can also see heart abnormalities or abnormal kidneys. Some more clinical presentations are short stature, and that's actually one of the most common presentations, but they can also present with obesity, webbed neck, small lower jaw, low set ears, short fingers and toes. They can have scattered brown spots on their body, widely spaced nipples, receding or small lower jaw. The arms can be turned outward at the elbow. They can have a low hairline at the back of the neck, and they can have edema of the hands and feet, especially at birth. You'll also notice that they have moderate intrauterine growth delay, slow growth from childhood, and then delayed puberty and bone maturation. Turner syndrome can also affect the reproductive system of a female, and it can result in delayed puberty, primary amenorrhea, infertility, rudimentary ovaries, which is just incomplete development of the ovaries. And once they do hit menarche and they do have their menstrual period, they can actually hit menopause earlier than normal females. So some complications of having Turner syndrome, and they are at an increased risk for hypertension, aortic dissection, diabetes mellitus, hypothyroidism, strabismus, and hyperopia. And I kind of want you guys to keep in mind the risk that they are at an increased risk for, because when we talk about screening recommendations, we'll kind of refer back to these risks. They're also at an increased risk for having congenital heart defect. And they can have frequent middle ear infections, and that's due to skull shape abnormalities. And the ear infections can eventually lead to hearing loss. They can also have learning disabilities, particularly in math and spatial concepts. They have difficulties functioning in social situations, and they are at an increased risk for ADHD. So this is just a picture of what symptoms a patient can present with if they have Turner syndrome. Once again, they won't have all these symptoms. You can see she has the brown scattered spots on her body. And just keep this picture in mind, and you can kind of refer back to this when you do have a patient with Turner syndrome and you're suspecting Turner syndrome. So some red flags that should point towards Turner syndrome are primary amenorrhea and short stature. If you see these two, then you should definitely suspect Turner syndrome. Also, if you do an ultrasound on a pregnant female and you see large fluid collection on the back of the neck of the fetus, then you also want to suspect Turner syndrome. And once you suspect Turner syndrome, you can run some diagnostic tests, which are prenatal testing include chorionic villus sampling, and as you're aware, it's performed during the first trimester, and you examine part of the placenta with this test. There's also amniocentesis, which is performed during the second trimester, and you examine the amniotic fluid here. In children, you can do karyotyping. And if you have a test that's positive for Turner syndrome, you'll notice that they have a missing or incomplete X chromosome. So there are genetic testing, but like I said earlier, there's no risk factor for Turner syndrome, but females with Turner syndrome who wish to get pregnant have an increased risk of fetal complication. And as a matter of fact, they are at an increased risk of intrauterine death from aortic dissection and rupture. So the purpose of the genetic screening is early identification for possible maternal or fetal complications. And also, I actually read this article and it said that females with Turner syndrome should consider adoption instead of trying to get pregnant because they are at an increased risk for complications. So how do you manage Turner syndrome? We can manage by giving injections like growth hormone injections, and you'll usually give them during the childhood and teenage years. You can also do estrogen therapy to begin puberty and sexual development. Like I said earlier, they are at an increased risk for infertility, and therefore you can do in vitro fertilization. But remember, they have all these complications, maternal and fetal complications. So you only want to refer them for in vitro fertilization after a careful cardiology evaluation. Also, the management of Turner syndrome has a multidisciplinary approach. And the multidisciplinary approach would include endocrinology, cardiology, genetics, otolaryngology, psychology, speech therapy, and ophthalmology. And all of these mainly because of the complications and risks that they have. So because Turner syndrome is a spontaneous chromosomal mutation, there is not really a preventative method. The goal is just to minimize complications. And the way that you can minimize complications is through early detection. So these are the screening recommendations that I was talking about earlier with the risk factors. So because they are at an increased risk for all those conditions, annual screening tests and periodic screening tests are very important. Annually, you want to test their thyroid function. You can do a fasting blood sugar or test their hemoglobin A1C to see to make sure that they don't have diabetes. You can do their lipid evaluation, and you want to check their blood pressure for hypertension. Periodically, you want to check their cardiovascular. You want to do a cardiovascular evaluation. You could do a hearing evaluation. You can do evaluation of their ovarian function. And because they are at an increased risk of learning disabilities, you want to make sure that they can have support groups if they need it, and also they have enough knowledge about Turner syndrome. So I was able to find a clinical practice guideline which was published by National Institute of Health in 2007. It has not been updated since 2007, and the link is on the slide for you if you want to go ahead and look it up. But the guideline is for the evaluation and treatment of patients with Turner syndrome. So some patient and family resources. There's Turner Syndrome Society of the United States. And if you actually go to their website, they have a ton of resources, and you'll find resources that you can go give to families and the patient. And you'll also find that they explain what Turner syndrome is and how it's managed. It's a really good website that you should definitely recommend for your family members and patients who do have Turner syndrome. There's also Turner Know Your Body. It's an online book. There is Turner Syndrome Foundation, and there's also National Human Genome Institute. So in conclusion, Turner syndrome is marked by missing or incomplete second X chromosome. There are no environmental or genetic causes. It does include a wide range of clinical symptoms. And just think back to that picture that I had on the slide. And if you can just remember that picture and the symptoms that were on there, you will be able to recognize a patient with Turner syndrome. They also can present with short stature and primary amenorrhea. And if you remember, these two were the red flags. So you definitely want to suspect Turner syndrome in a patient who presents with short stature and primary amenorrhea. Turner syndrome does have a multidisciplinary approach for management to minimize complications. And you also want to do periodic screenings for early identifications of complications. And this concludes the presentation. Here are my references if you do need to look back. And also, if you have any questions, please feel free to email me.